say it's 80, 90, 70. It depends on the way you phrase the statement. But it could be 500, 600%. It could be 90%. It doesn't matter. We've gotten you the largest reductions in history, the largest reductions. We were the most overpriced. We had the highest price for prescription drugs anywhere in the world, and now we have the lowest prices anywhere in the world. That's all you have to know. And to get that, because Oz said to me, it's going to be very tough. The drug companies are going to be bad, but we had to get the approval of other nations. As an example, I talk about the fat drug. The fat drug, a friend of mine who's extremely fat and very wealthy and very obnoxious. He's a very unattractive individual, actually. But he's extremely smart, very, very successful. He's a highly neurotic person. Semi-controlled, I would say. Usually I like to say I like a neurotic person, but it has to be controlled. This guy's only semi, but he's in London, and he calls me, he goes, President, in New York, I'm paying like $87 for the fat drug. He called it the fat shot. I've given it that name, the fat shot. And I said, well, it's not working too well for you. But he said, I pay $87 in London. In New York, I'm paying like $1,300. So I'm paying $1,300 and what's that all about? And other people would call me the same, but he made a big imprint because he's a very smart guy. He said, you know what, I had it traced. It's made in the same factory. It's made by the same company. Everything's the same except the price. One's $87 and one's $1,300. He said, this is ridiculous. And it did hit me the right way. And we went to town, didn't we, Oz? We went to town. And we shamed the drug prices because they were, for years, said, well, it's research and development. I said, well, it's research and development for them also, right? But we got them. They weren't easy, but we got all of them lined up. But they said it didn't matter. The reason we got them because they said we'd never get the other countries. We had to get approval of the other countries where they'd have to double their prices and triple their prices because we come way down, they go up a little bit because the world is bigger than us, right? So they go up a little bit. So I'd call up, like, as an example, France. I spoke with Macron, right? You know Macron, he's a wonderful guy, president of the country, a nice guy. So I say, Emmanuel, your drug prices are a tiny fraction of ours. We can't have that. We're going to have to raise it. No, Donald, I will not do that. No, you will do that, Emmanuel. No, you'll do it. 100% you're going to do it. No, I will not do it. And this went on for about 2 minutes. I'm saying you will. He's saying he won't. So most people would say he won't do it. Then I said to him, Emmanuel, if you don't do it, I'm going to put a 250% tariff on all wines and champagnes that you ship into our country. And he said, Donald, how dare you? You should not do that. You cannot do that. And I said, no, I'm going to do it. Okay, you have a deal. That was it. And I told Oz couldn't believe it. He couldn't believe it. And we had the same thing with Germany. We had the same thing with the other countries. I said, look, you're not going to do it. We're going to tariff the hell out of you at double the number that you're talking about. And they all agreed. Every one of those countries agreed. And now you have the lowest drug prices anywhere in the world from the highest. And that alone should win us the midterms. But, the fake news doesn't like to write about it. They don't even like. I noticed a couple of the cameras went off when I was talking about it. When I'm getting to a really juicy subject, to me, that's a juicy. Think of it. I mean, you talk about healthcare. It's all around medicines and everything else. And Byron, how big a deal is that, right? By the way, this guy's going to be a great governor. Okay. Going to be great. Ag Commissioner, you just stand up. What a job he's doing. What a job he's doing. My Ag Commissioner, who I endorsed a long time. So I just want to thank you all. You guys are doing a great job. Byron, you're going to be fantastic. We have somebody named Ashley who's very respected. Will you please stand up? Senator, our great senator. I saw polls, you were all leading like a lot. But remember, make it too big to rig. You got to go out and vote. Don't assume anything, you know. We did great in the second election. It was a rigged election, but we did great. And I said, well, I had the ultimate poll because we won the second election by a lot. So that's a good poll. So we did it again. And I said, too big to rig. You got to make it too big. They showed me leading by a lot. I said, don't be fooled. Just go out and vote because they are cheaters. They cheat like hell. But all of you have to do, and really what you want to do is Trump, and I didn't name it. This was named by Bobby Kennedy and Dr. Oz. I did not name it. Is that right? I said, what is that? TrumpRX.gov, okay? I said, everyone thinks I put my name on it. I don't think I'm going to put my name on medical things. I mean, you know, medical things can be very dangerous to have your name on, to be honest with you. But it's setting, I guess, records from what I understand. There's never been anything like it. So TrumpRX.gov, go to it and buy your medicines for very little money. Very little money, difference. Nobody's ever seen anything like it. And I wish the press would talk about it, but the word is out, and it doesn't probably matter that much. The word is out. They don't want to talk about, they only want to talk about the bad, but this is really something that's special. I'm very proud of it. Today, I'm thrilled to announce that starting on July 1st, we will also provide Medicare patients with the coverage for weight loss drugs like Ozempic, Zepbound, Wegovy. It will be available for $50 a month. $50. Wow. Now think of that, $50 a month. So if it was $1,300, now it's $50, and the $1,300 doesn't cover a whole month. So it's really even more than that. So it's now down to $50. So that's where you get it. And also, and you remember when I cut insulin and I got it down to $25 insulin, it was $2,000. And that was before this. That was before this. I'm so glad you mentioned insulin. You know, when I got insulin done, it was at the end of my term and I got it done, but it doesn't kick in statutorily for 2 years. And I said, I better win the election. This is going into the second election because what a job I did. And, you know, insulin was at like $1,000, $2,000, $3,000. I got it to $25, but it kicked in about a year and a half, 2 years later. Statutorily, you had to wait a period of time and all of that nonsense. So I said, boy, I better win because if I don't, some guy is going to take credit for something that I did that they could have never done. Lo and